The cold and flu are two common illnesses that often get confused, but there's a difference between the two, so let's talk about them. The common cold is usually milder than the flu. Symptoms include a runny or stuffy nose, sore throat, and cough. Most people recover within a week without any complications. On the other hand, the flu can be severe and even deadly. Symptoms include fever, body aches, and fatigue. But how do you know if it's a cold or the flu? Well, the flu hits you suddenly and hits hard, whereas a cold comes on gradually and is less severe. Remember, prevention is always better than cure. So during the flu season, make sure you're washing your hands regularly. You can also cover your mouth and nose when traveling, and you can get vaccinated. I hope you found the information in this video useful.
Symptoms and treatment of flu. Even though flu can get better on its own, it can make some people seriously ill. First, let's go through the symptoms of flu. They are a sudden high temperature, an aching body, feeling tired and exhausted, a dry cough and sore throat, a headache, difficulty in sleeping, a loss of appetite, diarrhea or tummy pain, and feeling sick or being sick. The symptoms are similar for children, but they can also get pain in their ears and appear less active. There are a number of ways to treat flu yourself at home. These are: rest and sleep, keep warm, take paracetamol or ibuprofen to lower your temperature and treat aches and pains. Drink plenty of water to avoid dehydration. Your urine should be light yellow or clear. You can also ask a pharmacist for treatment advice and recommended flu remedies. Remember, antibiotics do not work for viral infections such as the flu. So doctors will not recommend antibiotics for flu treatment unless they suspect a bacterial infection also. We hope you found the information in this video useful.
Aside from washing your hands with soap, you may have heard experts talking about the viral load when it comes to protecting yourself and others from the coronavirus. But what does this exactly mean, and why is it so important? Here are two types of scenarios to help understand what viral load means. For example, in scenario 1, if you sit with one person and catch this virus, you will get a small viral load. Your immune system will start to fight it, and by the time the virus starts replicating, your immune system is ready to kill it. And so you may suffer from some symptoms of the virus, but importantly, you will recover and be fine. But in scenario 2, if you sit in the same room with 6 people that are all carrying and spreading the virus in some shape or form, you can get 6 times the initial dose. This rise in the viral load increases the chance of the infection to take hold in your body before your immune system can prevent it. So there is a higher chance of you becoming critically ill. Medicines will not help you in this process as there is no cure yet for this virus, but hospitals will support you with oxygen to help you breathe and, if required, a ventilator, whilst your immune system is given time to battle the virus. So when you are in isolation in your own home with your family members, it is important to pay close attention to some points. If you are a large family and one of you is unwell, even with mild symptoms, you should refrain from sitting in the same room, as this will make others unwell or more unwell if they are already suffering from the virus. So, for example, a family of 6 people may produce double the number of droplets a family of 3 in the same space would produce. This is why medical bodies recommend that if one of you is symptomatic in your household, you should assume you could all be carrying the virus, and so you should all self-isolate, and also make sure you keep some space from one another in your own home. Using face masks can also help reduce the spread of the virus, as well as hand sanitizers. All these measures can help to ensure a reduced exposure. This is the reason medical bodies recommend social distancing is practiced when possible and as much as possible until this pandemic is over. This obviously will be difficult for parents with young children who have the virus, as comforting your child during illness is a natural and must response. The number of people in a room is just one example given here that can have an impact on the viral load your body is exposed to, but by no means is it exclusive. It should also be noted that people with underlying health conditions such as cancer and autoimmune conditions can still be affected severely by even a low viral dose due to their immunity being compromised. Extra care should be taken. This is the reason social distancing is encouraged, as well as washing your hands with soap regularly.